or someone you know is about to have surgery, you better listen up here. This morning, we're sitting down with an anesthesiologist with what you need to know before going under the knife. Also ahead, we have a very important segment with information that you need to know here. Coming up, this gentleman right here, an anesthesiologist, sits down with us to tell us what you need to know before going under the knife.
All right, I think I'm ready to be put out until the end of the show. It's 7:21. It'll go by really fast, I bet. So, hey, it looks like I'm ready for surgery. Are you? We have an expert here to talk about important questions you should ask before you go under the knife. And Dr. Dr. Friedberg is an anesthesiologist who has the very delicate and important job of putting you out. So, hey, thank you so much for coming in. You just got me all set up. And you're with the Goldilocks Anesthesia Foundation. This is something that you founded?
Yes, I did. It's a nonprofit dedicated to letting Americans know that it's of vital importance to make sure if they have anesthesia that they don't have it without a brain monitor.
And this is what you have on me right here. Is
the sensor to the brain monitor is connecting here, and in a simple way of saying it, you want to finish surgery with the same number of marbles that you started with.
You're saying that sometimes, if it's not done right, you will wake up and not be the same person.
Exactly, and that's really the problem, because the hospital feels that they've done their job if they haven't killed you. Unfortunately, now that we've made mortality or death from anesthesia so minimal, it's 1.25 of a million, people are saying, well, geez, I'd like to be able to relate to my friends the same way I did before I went to sleep. I'd like to be able to balance my checkbook and little things like that. And that's just not on the hospital's radar. But for this $20 sensor, you don't have to have that risk.
Why did you feel it was important enough to start this foundation?
Because nobody's making money from this. The hospital can't charge for the sensor, the anesthesiologist doesn't make money, and the drug companies stand to lose as much as 30% of their drug sales if everybody had one of these, so we don't have to over-medicate. See, the problem of awake under anesthesia is the flip side of the same coin of being over-medicated.
These are the horror movies that you see where people are awake and feel the pain and yet can't say anything?
Right, exactly. And that is 1/10% of patients, or about 40,000 patients a year, not all of whom wind up with post-traumatic stress syndrome. The interesting thing is that the studies have shown that...
My heart rate goes up just thinking about it.
Yes. Studies have shown that with a brain monitor, 80% of those 40,000 don't have to have that experience. So we're talking about a very small number of people for whom 80% have the problem solved. The bigger public issue is the over-medication issue.
Now, what are the most important questions that people should ask, and do they have choices here, even if they don't like the answer?
Absolutely, they have choices. An informed patient, an educated patient is an empowered patient. And you want to know first and foremost if they use a brain monitor for anesthesia as a routine in the facility that you're planning to have your surgery. Otherwise, you say, thank you very much, I'm going down the street where I can have this done, because I'm not having anesthesia without it.
And now so many people have been following Michael Jackson and his propofol. Do many anesthesiologists get the question about propofol being used in that capacity? Because it was different for him, but that's what so many people talked about. It's the kind that knocks you out.
Well, interestingly, you should ask about that. People magazine interviewed me last year for Michael Jackson as a propofol expert, and this is not really propofol, but it's designed to look like propofol. This is almond milk, but it's why people call it the milk of amnesia. The thing that was different about Michael Jackson and millions of people who've had propofol safely is the monitors and the fact that someone was watching. He had neither.
Yeah, it was in his home, and I know there were some certain circumstances about that. So people can ask how long they'll be under and what are the side effects and what are the answers that they want to get.
The answer they want to get...
Because they just don't know.
Right. The answer they want to get is you'll be asleep long enough to have the surgery finished, and you'll not hear, feel, or remember any of the experience, but you'll wake up the same person you were before you had surgery, like the same number of marbles you had when you started.
I'll tell you, I was so nervous, as most people are before they go under general anesthesia. I don't even think I got to 8 in the countdown, and I was out, and it just feels like a second goes by.
Well, we'd like to believe in anesthesia that knowledge is a way to diffuse the nerves. And if you know that by using a brain monitor, I can neither give you too much nor too little, which is where the Goldilocks story comes in. It's always just right because it's your brain dictating to me how much drug to give you.
And if you ask and they say, no, we don't use one, then you find another one?
Right. Thank you very much, and I'm going to be going where I can get it, because the model for change is the same model for change that got fathers in the delivery rooms. If you asked obstetricians today, would they still like to have fathers in the delivery room? Say, be very happy not to. It's the same thing with the brain monitor. You're not interested in discussing the philosophical ins and outs. They say, hey, look, you're giving me drugs that medicate my brain. The technology that measures my brain is there. It's FDA approved, validated in 3,000 scientific studies. I'm not interested in this discussion. You either do it or I'm out of here.
All right. Hey, Dr. Friedberg, thank you so much for coming in. We'll have information to the Goldilocks Anesthesia Foundation on our website, too, and a link to that.
Very nice.
Okay, now can you get this up for the next
Yes,
thing?
ma'am. Yes, ma'am.
All right. As he's doing that, go to san-diego6.com and click on Hot Topics. That didn't even hurt.
No, of
How
course
about that?
Of course not.
I don't know how it looks, but anyway,
Well, your
we're going
hair's
to go
up
over
there.
to
There's
Renee
just some gel. There's just some gel.
and check on weather and traffic. Renee?
Linda, your hair still looks fabulous. I don't know how you do it. I really don't.